Parents ask me, what's the best treatment for kids? I'm Dr. Daniel Cameron. This is part of a Common Sense Lyme series where I address questions that I see in my practice. I wish I could point to strong studies that give us clear answers, but here's the reality. Children under 18 were not included in the NIH-sponsored Lyme disease treatment trials. Every major NIH-funded study on Lyme disease treatment, the trials people often cite enrolled only adults, usually age 18 and up. That means the so-called evidence base doesn't actually represent the population we worry about most, our kids. Why does this matter? Because pediatric Lyme disease isn't always the same as adult Lyme disease. Children often show different patterns of illness. A child may not complain of joint pain in the way an adult does, but parents might notice new school struggles, mood changes, fatigue, or sleep issues. These are easily dismissed as normal childhood issues unless Lyme disease is considered. On top of that, kids' bodies process medications differently, their immune systems are still developing, their nervous systems are still wiring, and the impact of infection or treatment decisions can play out differently in adults. When guidelines are based only on adult data, children fall through the cracks. That's exactly what we see today. The Infectious Diseases Society of America, or IDSA, issues strict guidelines that don't recommend extended treatment based largely on these adult trials. But the International Lyme and Associated Diseases Society, or ILADS, recognizes that many patients, including children, remain sick after standard care. I served as an author on the ILADS treatment guidelines, and we emphasize individualized treatment because children's needs often don't fit rigid timelines. This gap has real-world consequences. I've seen families desperate for answers, told that their child's lingering symptoms can't be Lyme disease because the adult-based trials didn't support longer care. But in practice, some kids relapse if treatment is stopped too soon. Others improve only when co-infections like Babesia or Bartonella are addressed. Without pediatric trials, families and physicians are left navigating uncertainty with little direct evidence. That's why I keep saying Lyme disease treatment for kids requires careful, individualized decisions. It cannot be a one-size-fits-all. Until children are included in research, we have to rely on clinical judgment, family input, and careful monitoring. And parents shouldn't feel dismissed. If your child is still struggling after treatment, it doesn't mean it's all in their head. It may mean the research has simply not caught up with their reality. The bottom line is this: children deserve the same level of research and attention that adults receive. Until then, we must approach Lyme disease treatment for kids with flexibility, compassion, and individualized care. Thank you for joining me for this Common Sense Lyme commentary.